welcome to the Leica 2021 Online Cataract Symposium. Thank you for being with us. We hope you will enjoy this clinical symposium on the benefits of direct horizontal chopping in the field of cataract surgery with Dr. Mohamed Tawfik. My name is Didier Gore, and I will be your host today. I'm the Clinical Sales Manager of Ophthalmology in the region of EMEA for Leica Microsystems. It is now my pleasure to introduce to you Dr. Mohamed Tawfik, who is ophthalmic surgeon at the Ferdous Eye Hospital in Zagazig in Egypt. He's also a consultant vitreoretinal ophthalmologist for the Memorial Institute of Ophthalmological Research in Giza. In addition to his surgical practice, Dr. Tawfik is involved in various activities for education and research. His area of interest cover, of course, cataract, but also refractive and retina surgery. So, Dr. Tawfik, the floor is now yours.
Thanks, Didier. Good evening, everyone. It's my pleasure to be here with Leica in this clinical symposium that we are talking about direct horizontal chopping, a technique for better surgical outcomes. As you know, we will talk today about the direct horizontal chopping technique basic knowledge, and we go through some clinical cases to demonstrate the benefit of this technique, and also we'll go through to my experience about the Leica microscopes that I'm using. So, as you know, the Phaco techniques may be done by a lot of techniques. Some of important of them is divide and conquer technique, stop and chop technique, direct chopping technique. Symposium we will strictly demonstrate the direct chop and in specific the direct horizontal chopping technique. Why we chop? Because we need to do a chopping technique because it's a less power. You will need to use less power for phaco ultrasound. You will have a less stress in the zonules, and you also less dependence on red reflex. So if you decided to work the chopping technique, you will end up by a less power needed to eat the nucleus. When you search for the chop, what's the meaning of chop? The chop is cut something into pieces. So if you need to cut something into pieces, it's meaning chop. The golden rules of the chop is fixing the part to be cut, and the right direction is a must. As you can see here in this photo, if we need to chop the piece of wood, we need to fix a part, we need to be cut, and to know what is the direction of the fiber and go parallel to the direction of the fiber to chop the wood. So if you are not fixing the wood and you are not knowing the direction of the fiber, you will not chop. So the chopping is a disassemble, not fracture. So you are splitting, not fracture a piece. If you need to split, you need to know the direction of fiber of the nucleus. This is the image demonstrate the orientation of lens fibers and the planes of lens fiber. The lens fibers go like this way in oval shape. So you need to know the direction of lens fiber, go and fix the nucleus and split this fiber from each other. First, you need to know when we need to chop, we will chop the nucleus. We will not chop the epinucleus and we will not chop the cortex. If you need to chop the nucleus, you need to delineate the nucleus. As you will see now in this video, this is the technique of delineation of the nucleus. Go hydrodissect the cortex and delineate the nucleus. And also, after delineation, make a slight rotation to keep this part of the lens freely mobile to better control of holding. So the hydrodelineation of the nucleus, I think it's one of the most important points in horizontal chopping. When you decide to chop, you need to ask yourself these questions. Where to start? The phaco tip is bevel up or bevel down, the speed of chopping, and the direction of chopping. Let's start with the first 3 points. Where to start, and for you, bevel up or bevel down, is it important? The speed of the movement of the chop, how it's high speed or moderate speed or low speed. Let's see this a short clip to demonstrate the technique of where to start and your bevel up or bevel down. For me, I use the phaco tip with bevel up. My chopper is behind the nucleus. My speed is moderate, not low or high speed. Starting from engaged from the middle of the nucleus, chopper is behind the lens, the movement is moderate, not fast and not very slow. All what we are talking about is an issue, and this is the most important slide if you need to learn what we are called chopping technique. This slide, print this slide in your image. If you see the point number 1 and the point number 2, the point number 1, it's a direction of the chopper going from side port to point number 1. Now, point number 2 is a direction of the phaco tip going from the main wound to point number 2. What we are needed is keep number 1 to go to number 2. If you move number 1 to number 2, you will split the fiber. But if you go from number 2 to number 3, you will separate the lens fiber. So the direction of the chopper when we go to number 1 must be to number 2, which is the tip of the phaco tip. But it's not only important, we need to go from number 2 to number 3 to make it like a J shape, to separate the splitted fiber. Let's stop at this point and make some pool questions. What you are benefit from the last slide, what are the benefits of direct horizontal chopping for you? Is it more stress on the zonules, or is it less phaco power, or is it a direct of chopping is not important? Let me make a poll slide to give some engagement with us, and we'll give you some seconds to choose what is the true for these 3 answers about the horizontal chopping. Is it more stress on the zonules, or is it a less phaco power, or the direction of the chopping is not important? We will move to the next slide to see the poll result. Perfect. So the 88% of the attendees accept the questions of the horizontal chopping is a technique with a less phaco power. To conclude the basic of horizontal chopping, you need to know one slide, one concept. The horizontal chopping is a meaning of splitting, so you need to know your perfect direction. The direction of movement of the chopper toward the phaco tip is the golden rule, is the rule. This is the rule. If you are not learning how to move the chopper toward the phaco tip, you will not split, you will not separate the lens fiber. So it's a meaning of direction. The direction is according to rules for the horizontal chopping. So now we will move to demonstrate some clinical cases that show the meaning of good direction, good splitting, good separation. Let's start with the first case. First of all, when you're starting, engage and chop the nucleus, remove the epinucleus and cortex above the nucleus. And when you remove this part of epinucleus and cortex, start to engage. As you can see, I can rotate the nucleus freely because I delineated it perfect. Now, in the middle, I will engage, go with my chopper. If I need to be sure that this chopper is behind the anterior capsule, I will scratch over the nucleus, go behind the anterior capsule, move number 1 to number 2, and this number 2 to number 3. If you move from number 2 to number 3, you will separate. Again, chopper behind the nucleus, move number 2 to number 3, and number 1 to number 2, and from number 2 to number 3. Again, you can see chopper behind the nucleus, split, separate. The last one that I did for separation is a critical, because not only splitting will separate the part of the nucleus fibers from each other. Now you can get every single piece and eat it freely. I will show you another case, demonstrate the idea of direct, perfect horizontal chopping with the meaning of direction, perfect direction of the movement of the chopper towards the tip of handpiece. You see, now I go again, chopper towards the handpiece and horizontal movement. I separate now the two pieces. Again, fix, chopper, chop towards the phaco-tip and make the horizontal movement. And now you can engage every single piece freely and go it out with high vacuum, ultrasound, 20, 30, and eat every single piece separately. It will be nice. So the phaco-tip holds the nucleus. The chopper go towards the phaco-tip. Keep looking by your eye towards the phaco-tip. Engage, chop, go to the phaco-tip, not go to the side port. If your chopper is going to the side port, the lens will rotate, not will split. Is it work with a hard nucleus? Yes, it's work with a hard nucleus. So if you see, this case is a very dense nuclear grade 4 cataract, and if you follow the rule, you will succeed. Engage, move the chopper towards the phaco-tip and make the horizontal movement. You can see now, chopper behind the lens, chopper towards the phaco-tip, horizontal movement. The nucleus will split it and divided in 4 quadrants. Again, chopper towards the phaco-tip and split. The phaco-tip here have an important point is just fixate the nucleus. So if you have a good fixation, you can go with the chopper towards the lens without any movement of this lens, So it's this hard nucleus. I just divided the nucleus by chop. So until that point, I didn't use a lot of ultrasound. So the phaco technique with horizontal chop, we will actually use a less phaco power as usual we are used in the divide and conquer or in the stop and chop technique. You can see now we eat every single piece separately, very nice with a little amount of ultrasound. And if you also need another chopping for this piece, you can chop by the same technique. If you have a soft nucleus, grade number 1, grade number 2, you can chop? Yes, you can chop. But if with a very, very, very minimal maneuver, you need to have a good control, because if you have a soft nucleus, the chopping will be more difficult. You will see in this case, I engage the nucleus. As this nucleus is a little bit soft, I go behind and just split. But separation, it's much more less because the lens fiber is soft, so I cannot totally separate. I just split. So when I split it, I just eat the nucleus above the capsule and the job is done. So if the nucleus is soft, you can split, but the separations of the totally lens fiber, it may be something difficult because the lens fiber is a little bit immature and we cannot totally separate the lens fiber in a soft nucleus. One of the most important things if you need to learn the direct horizontal chop is when you have unstable bag. If you have extensions, anterior capsule, and unstable bag, this technique is perfect to keep your bag safe. You will see in this case, how can we chop the nucleus in unstable capsular bag with anterior capsule extension. And also see how when I move very quick to the chop, what happened? You see, I move very quick. So be calm and move your chop very controllable towards the phaco tip. And don't forget the horizontal movement. Believe me, the horizontal movement is a key. Go towards the phaco tip and do the horizontal movement. Because the movement from the chopper to phaco tip is just to split the fiber. But when you go from the phaco tip horizontally, you separate this fiber. So you can now eat every single piece freely separated from the other side. Also, if you have a piece and go it up the capsular bag and feel that it's more or it's enlarged, you can chop it again. You can use your chopper again if you have a large piece that like what I'm doing now. Just split more and more, chop it more and more. You see here how the bag was unstable, but I have no stress in the zonules. I never use any stress in the zonules. I just chop the bag, the nucleus inside the bag, and a lot of chopping to decrease the amount of ultrasounds that I needed. Engage the nucleus and get it out from the bag. Eat it freely in the pupillary plane, not far in the anterior chamber to keep your endothelium safe, and your job is completely done. So this technique is safe. This technique is safe and also in an unstable capsular bag. As you can see also here, I do a lot of chopping to decrease the amount of ultrasounds that I'm using. So this case is done. Let's refresh some knowledge and go for a poll, next poll questions. In which type of cataract you can best do a direct chop? Is it a cortical cataract, or is it a posterior subcapsular cataract, or is it a nuclear cataract? If you have a cortical cataract, and if you have a posterior subcapsular cataract, and if you have a nuclear cataract, tell me what is the type of cataract you will do a perfect chop technique. Let's see the result. Perfect. 94% of attendees accept that the nuclear cataract is the best type of the cataract that we can chop, because we already know that we are chopping the nucleus. We are separating, we are splitting the nuclear fibers, not the lens fiber, because if the lens fiber is soft, you cannot separate. So as you have a large degree of nuclear cataract, you can get, or you can have a best chopping technique. I think you now have a good knowledge about the idea of horizontal chopping. I will now speak with you what is my benefit when I use this technique in a Leica microscope. I have a 2 years experience with a Leica surgical microscope. I have a 2 type of microscope, Proveo 8 and M22. This is my platform in my surgical rooms. About M22, the M22 is a surgical microscope with enhanced red reflex, meets the highest professional requirement of ophthalmic surgeons to perform a cataract surgery more precisely and efficiently. For me, illumination solution combined the lead and the halogen have a perfect stable red reflex. Ergonomic design for intensive control of the system and comfortable working position give you a freely mobile and low space occupying surgical microscope in your surgical room. You can attach it with this M822 a high definition videos to share with discuss as I do with you in this clinical symposium. And interchangeable floor stand, it gives you a better control for your work. As you can see here in this short video, what the beauty of M822 with a large working distance I think this is one of the best advantages of this microscope. And also you can see that I recorded this image with a beautiful red reflex from the training side tube. So also we have a perfect red reflex in the main tube, and you have also a perfect red reflex from the side tube. And you also can engage a high definition surgical camera on the microscope, which is giving you a highly recorded video, and you're giving you a highly visualization system in your OR to have a good control in what happened in the OR and controlling the surgeries all the time. This is one of the most important benefits from this microscope. For Proveo 8, for me, it's the best ever microscope. You can use it for any type of intraoperative surgical microscope, cataract surgery, vitrectomy, whatever. It's the best. We have a critical point with Proveo 8 is a fusion optics technology. We have a 2 separate beams path. One beam path provides 40% increased depth of field, and the other beam path provides high resolution. So we have 2 separate beam paths for the main tube and the side tube, and also a separate control for the camera. You have also a visualization camera with a 4K screen. You can control the visualization separately from main tube and from side tube. And also stable red reflex, constant image. And you can see in the next short videos how the platform of Proveo 8 with also a good working distance and attached dual beam paths of the side tube and main tube and visualization system attached to the microscope with a 4K screen, you will give you a better platform for you as a surgeon, for your fellows as a fellow, for everything in the room. You can watch every single step we are doing in the surgeries. Like at all, Proveo 8, M822, you will see a better red reflex. For better red reflex, you will give you a better visualization with a better control for your rexes. Because I see that this is the step we need a better red reflex. And I will show you a different case with that I'm doing rexes forceps with help of a good red reflex of either M822 or the Proveo 8. You see beauty of the red reflex and the beautiful control, and also the red reflex is stable. You didn't need to refocus again. You have a perfect focus all through, from the conjunctiva, blood vessel, up to the core, the capsule. Everything is focused, and you have a good control. See this case, have a better red reflex with beautiful control of your rexus forceps, and beautiful control for demonstration, and also beautiful control how can you adjust the size of your rexus. This was in the last one was in M822, and this one in also M122. Beautiful red reflex. And also, you can control the brightness of the microscope independently in the red reflex. So you can decrease the bright of the microscope, increase the brightness of the red reflex, and vice. You can do it separately. Not like other microscope. If you have to know to get a perfect red reflex, you need to close the brightness of the microscope. Beautiful red reflex with beautiful demonstration of the capsular axis. For me, I have also addition that you can use it with a Proveo 8 or even with a M822. You can add a 3D camera over the microscope. You give you a chance to work in heads-up visualization with a brilliant image, even in a dark environment, and powerful educational tools. I will show you how can, with the Proveo 8 and the camera, 3D camera, you can see a beautiful magnifications, beautiful control of the light, even red reflex and main light separately. So you can give you a perfect visualization on the 3D screen and perfect demonstrations of your steps of the cataract surgery without need to refocus and refocus again. And now I will revise with you the step of direct chop. Go with the chop towards the phaco tab, do horizontal chop, again behind the nucleus, towards the phaco tip, do horizontal chop, horizontal movement, last piece, chopper behind the nucleus, and do horizontal movement. Beautiful. If you have a 3D with the Leica microscope, you will, I can promise you, you will have a perfect control and a perfect visualization for your cataract surgery. It's an amazing tools if you have this platform. It's an amazing educational tool if you have this platform. 3D and Leica. 3D and Leica, you will have a perfect educational tools. As you can see, all the staff in the room can see what you happen. All fellows can follow your surgical steps. It's amazing. You can follow every single step your fellow doing, and also your fellows can follow every single step you do. So it's an amazing educational tools if you have this combined platform, 3D visualization system with the Leica microscope. You can see here, the consultant follow the fellow's surgery is every single step in a clearly demonstrated magnification and visualization. In conclusion, why to chop? For me, the chop is less power and less stress in the zonules, and the dependence on red reflex is less. And let me add another point. If you are a surgeon and moving from another room to another room, and you are not strapped to one surgical, to one phaco machine, believe me, if you master a horizontal chop technique, you will not end dependent on the machine. You will dependent on your hand, because the larger steps of your surgeries are done by your chopper. You divide the nucleus by your chopper, so you will not depend more on your phaco machine. Good visualization with a good microscope helps you improving the surgical experience. So believe me, the microscope play an important role in your cataract surgery. If you have a good red reflex, if you have a good working distance, if you have a good magnification, you will do a great job. And thank you for watching, and I hope I can add a knowledge for you about the cataract surgeries and the horizontal chopping technique.
Thank you, Dr. Tawfik, for this insightful presentation. Before moving to questions, I just would like to remind that, of course, among the Leica technologies that can support cataract surgery, you've illustrated a couple of these, of course, the Proveo 8 and the M822 microscopes. These are not the only ones, as you can see from the slide here. So if anyone in the audience would like to learn more about these microscopes, you can request, of course, a private session or a remote demo with Leica experts. There are several solutions available. And this brings us actually to the last poll question of this symposium that we kindly ask you to answer as well. So in case you would like to be recontacted by Leica, what of the following options would you prefer? So number one, whether you would like to exchange on your need, whether there are current needs or future needs, expected ones, or if you already would like to schedule a demo remotely of a specific instrument, or if you already have a direction and would like to get a quotation about a specific product. And finally, whether the time is not yet ripe and you don't want to be recontacted. So I kindly ask you to choose one of the four options here, and then we will, of course, respect your choice and get back in touch with you, or one of our partners will do directly. So pick up your choice and click submit again. This is for the last time, and then we will switch to the Q&A session. Okay, So, Dr. Tawfik, we have actually many questions here. So I guess you can see some of these as well. I will start from the top here. The first one, the first question is how to make sure that you're avoiding the capsule when you chop. Can you give some answer on that?
Yes, I hear for you, but this is not a question that appeared to me. Is there is any special chopper for this technique? This is what I'm seeing.
Sorry. Yes, okay. This is not the one that is pushed. Correct, yes. So let's go for this one then. Apologize.
Okay. Is there any special chopper for this technique? So as we said in the slides before, the chopper technique is depend on the direction, not on the sharpness of the chop, not on whatever the chop made it from. It's about the direction. But if the chopper is easily designed to go behind the lens safely, you will be more better than if we have a sharp chopper, so if you go behind, you can injure the capsule. So it's better not to be sharp. It's also better to have a curve to go behind the nucleus in the curvature of the nucleus. So it's better to have a curve. It's better also to have something like edge in the side of the chopper, so you can chop by the side way of the chop, not usually you need to go from the inside the chopper. So it's not any special chopper, no special chopper, just know the safe chopper for you to chop.
Thank you. Next question, how to make sure you're avoiding, next question. Yeah. Yes, now we get the right one. How to make sure that you're avoiding capsule when you chop? Actually, was the first
small.
Thank you.
It's a trick. When you have the nucleus, go with the chopper. Can I demonstrate it with a small video? Because this one we need to play this video again. I will go to this video and play it to be demonstrated more well. So this one is demonstrate what we are seeing very well. Okay? Scratch over the nucleus to be 100% you are inside behind the anterior capsule. This scratch, what I'm doing in the nucleus is a key. I'm scratching over the surface of the nucleus. So I am now 100% sure that the chopper is in behind the anterior capsule, not above the anterior capsule. So this scratch is critical. GD. So we are finished this.
Okay. So next question, do you use the same power setting for chop and segment removal?
For me, yes, because in Phacoemulsification, I just need this Phacoemulsification to fixate. I didn't need a complete hold. So I just fixate the nucleus with the Phacoemulsification. So it's the same technique, same Phaco power, high magnification, about 30 to 40 power, controlling the power with my foot switch, make it the power starting from 0 to 30 or to 40, and controlling the ultrasound, just fixate the nucleus. It's not the same if you need to do a vertical chop. If you need to do a vertical chop, you need to have a good grasping power so you can move with the nucleus up and with the chopper down. It's different. The horizontal chop just need to fixate and go with a direct way from number 1 to number 2 by chopper, go to the Phacoemulsification. So it's the same parameters for me, for chop and for segment removal.
Thank you, Dr. Tawfik. We have also another many questions here. Some of these are similar actually. So here's one about the red reflex, more linked to the illumination. Is the red reflex strong enough throughout, or do you have to rely on vision blue frequently and re-dye?
No, because I already working in a better platform of microscope. So I usually do the vision blue only in white cataract or dense cortical cataract. So in 90% of my cases, I have a good visualization of red reflex. So I rarely depending on vision blue for capsule rexes.
Thank you. Next question. So what about the bevel side wise in opposite to crack?
What about the bevel side wise in opposite to crack? I didn't understand the questions really. What about the bevel side wise in opposite to crack? I didn't understand these questions.
Let's go to the next one here. We have here, actually there are two questions which are linked to the kind of chopper you were using here. So
it's also an Igahara. This is my preferred chopper.
Sorry?
It's an Igahara. It's my preferred choppers, but I need to highlight that it's not dependent on the type of the chopper. It depends on the how you know the meaning of it, the horizontal chop. So if you have any chopper in your OR, just see if it's sharp, remove it, don't use it, and see how it works. So I use any type of a chopper. I just avoid the sharp one. Just avoid the sharp one and use any type of a chopper.
Okay, thank you. Another question here, which is a kind of tricky question as well. Why do you keep the chopper in the AC finalizing the chopping? This negatively influences the fluids during quadrant removal, since some flow is diverted away from the
perfect question. This one is really good question because we need to highlight some point. Why do you keep the chopper in AC after finalize the chopping? As we show in some cases, you need to use the chopper even in the pieces you chopped. If you have a large piece, you chop it, you need to use the chopper again to chop it in small pieces again. So I keep it until I remove all the nucleus. Number one. The number two, I have no leak from the side port because I just grasping the nucleus. I don't grasp the chopper. I just handle the chopper. Because if you grasp the instrument, you will transmit this grasping power to the side port and you will have a leaking side port. If you have an idea of just handling the chopper, keep it handled, not grasp it, you will not see a paracentesis leaking and the fluidics going outside the paracentesis. Just handle the chopper and keep it standby. If you need it, go and chop it the piece. If you don't need it, keep it in a negative way.
Thank you. Next question. So here, I split the nucleus with the Neuhann spattle only in the middle, no chopping movement from point 1 to point 2, no direction is needed, probably less stress on the zonules. Is that, do you agree with that?
It's okay, it's another way, but I think we need to have this spatula. It's perfect way also.
Thank you. Another question, we still have time. Do you have to refocus frequently during the course of surgery? This is more linked to the microscope technique as well.
I didn't need this because we have a good depth of focus with a really amazing focus also from cornea to posterior capsule. But sometimes a little of refocusing I'm using, to be honest, but it's not frequent. It's very rare to refocus again. That I'm doing and focusing on refocusing, it's the camera refocusing. because I need to get out a perfect recording videos. So I tell my assistant, keep focusing on the visualization on the screen, keep focusing on recontrolling the focusing of the camera, because the camera have a line of focus. The main microscope have a depth of focus. So you can be focused on the microscope, but defocus in the camera. So the more refocusing we are doing in the camera, not in the main tube.
Okay, that's a good news. That's nice to hear as well. Thank you. Next question, how deep is the tip?
It's dependent on how deep is the nucleus. If the nucleus is shallow, if the nucleus is shallow, your deepness of the tip is shallow. If the nucleus is deep, you will need to go deep. It's dependent on the deepness of the nucleus.
Thank you. So next question. Let's see what is...
Sorry, Didier. Can I add some point, please?
Sure.
You need to study the nucleus that you are planned to work before you work. So see well the patient in the clinic before the surgery and study the nucleus. And don't mean study the crystalline lens. Study the nucleus. See the size of the nucleus. See the depth of the nucleus. See the grade of the nucleus. So before surgery, you have a plan. How can you attack this nucleus? So don't be just on table, decided how can I work. Before the surgery, assess all things, size of the nucleus, depth of the nucleus, so you already have a plan for this nucleus to be attacked.
Clear. Yes. Thank you, Dr. Tawfik. Next question, please. Can be pushed forward. Thank you. Is phaco tip size important for this technique?
No, because the phaco tip have only one rule in chopping, just fixate. By the way, you can fixate the nucleus. By the way, you can fixate the nucleus by any tools, not a phaco tip. You can bring anything, just fixate it and go like this. Yeah, it's a matter of fixation. The phaco tip have an important role in the quadrant removal. But after you are chopped the nucleus, you will eat the nucleus. So if you have a tip designed perfectly, you will have a good quadrant removal. In a chopping technique and the matter of the concept of a chopping, you need just fixation. But it's different in vertical chopping. If you have a vertical chop technique, the vertical chop technique is totally dependent on the phaco tip and the holdability of the machine. So you need to know this is the big difference in vertical chop and horizontal chop. Vertical chop, you need to know this is a special chopper for vertical chop. You need to know that the phaco tip is important in vertical chop. You need to know that the engagement and vacuum and the power of your machine is important in vertical chop. Horizontal chop, it's never dependent on all of this.
Yeah, so you answered partially to some other question about the differences as well with vertical chop. So next question is coming up. Do you use the bimanual technique for irrigation aspiration? And what are the practical advantages of this, if so?
This is because I don't have a coaxial. This is the only reason that I don't have the coaxial. But I see that the only advantage of a bimanual technique of irrigation aspiration is you can handling the cortical fiber in the 12 o'clock. This is the only advantage, and all the others is disadvantage because the coaxial technique is a better for the bimanual technique. But I don't have the coaxial technique, by the way. So I usually do the bimanual technique.
Okay, thank you. Next question coming up. Yes, you showed, you've been talking about the two microscopes, the M822 and the Proveo 8. At your eyes, what are the most important difference to you? I remember you already commented that to me.
Yeah, for me, it's no different. no difference at all. As you know, the Proveo 8 is more expensive than M22, but as a cataract surgeon, M22 is ideal. It's perfect. Walking distance, amazing red reflex, side tube perfect, compatibility of visualization and camera on the microscope, compact microscope, no space occupying. It's amazing for cataract surgery.
Okay, yes. In terms, when you're looking at your platform, you're teaching as well. I mean, you tend to use the Proveo, I understand, for the 3D as well. Is that correct?
Yeah. I use the 3D for both Proveo 8 and M22. I use the 3D in both platforms. It's working very perfect in both platforms. Okay,
thank you. Which microscope fits more small ORs? So the size of both microscopes are quite different. What does it mean for the space? Yes, I could answer part of that question, but your opinion is more important.
M122 is the best for space. For space, it's the best.
Okay. Thank you. Next question. Can you push it forward? Thank you. Is it easier to learn horizontal chop compared to vertical, or equivalent? Or
I need to be honest. I tried to learn the vertical chop, but for me, it's very, very difficult than horizontal chop. So for my experience, horizontal chop is easier than the vertical chop. Because also, I told you, the vertical chop is dependent on the type of chopper. So you have a special chopper, the holdability power and the powerful of the phaco machine, and the concept of hardness. So in the vertical chop with the soft grade 1, grade 2 nucleus, it's very difficult. So horizontal chop for me, in every grade of nuclear cataract, is going well. From nuclear grade 1 up to 4 to 5, like what I'm showing in the slides.
Yes. Thank you. Next question. So what is your choice of phaco power in horizontal technique? Or does it remain the same for all forms of cataract?
What is your choice of phaco power in horizontal technique? For the parameters of the phaco machine, I have the concept of linearity. I use the maximum vacuum and the maximum available ultrasound and control the vacuum and ultrasound linearly, starting from 0 to the max. So if I have a nucleus with dense, I use more ultrasound controlled by foot switch. So I didn't change a lot the parameters of phaco machine. I just make it on linear way and control it by the foot switch of the phaco machine. So I didn't rely on the phaco power. What is your choice of phaco power? Make it from 0 to 40 and control it from your foot switch. You can take it 10, you can take from 40, 20, you can take it from 40, 30, according how power you need to go inside the nucleus, or you need to fixate the nucleus. So it's controllable by your foot pedal.
Very good. Thank you. We still have some time for a couple of more questions. So here's the next one. Does a flared phaco tip helps more to hold the nucleus?
No. The flared phaco tip is perfect for eating and for quadrant removal. I didn't see any difference between flared phaco tip for the horizontal chopping. As I tell you, I didn't depend on the parameters of phaco tip, on the specifications of the machine and chopping technique. I rely on the machine and the specific of a tip of the machine in quadrant removal, how it's fast eating the quadrants.
Thank you. So any further question being pushed? Let's see. Okay. Yeah, here, general question. This is probably also addressed to Leica directly. Do you have any presentation of OCT integrated? I mean, this is here. I would like to rephrase the question to you. If you heard or if you do you foresee any application of the intraoperative OCT for cataract, because this is so far not a requirement or rarely used, but in some cases it is.
I don't have any experience about the OCT integrated in the microscope used for cataract surgeries. I have an experience with the retina surgeries, with the corneal surgeries, but I didn't have any experience with cataract surgeries until now.
Yes, thank you. So we will see if there is any other question pushed forward. Otherwise, I will pick any.
Can I ask? I reply for these questions.
Yes.
Put it
Let's see. There is a last one. There are a couple of others. We still have a couple of minutes. So here, general question: can I learn direct shopping from CART, which means from? Oh, sorry. There is has been pushed by Christian here. From your experience, what is the best way to get a good depth of focus with the M822 with the best red reflex?
Let me learn all of these step. If you need to get the best depth focus with any microscope, especially M822 with the best red reflex, make the steps. When you set up your position, first of all, check the position of the patient head to be the globe coaxial on the microscope. So change the position of the head to be sure that the eye is coaxial on the microscope, not the head. The eye is coaxial on the microscope, number one. Number two, high magnification over the limbus. Focus while you are in a high magnification on the blood vessels of the limbus. If you have a good, clear view of the blood vessels of the limbus, get a low magnification and centralize your view with a cornea, and now we will get a perfect red reflex and also control of the focus. You don't need to refocus again. So the type of focus is, first, do the focus with a high magnification. Don't do the focus with a low magnification, because if you do a focus with a low magnification, and you play with the magnification during the surgery, the focus will be unfocused every now and then. So first, do the focusing with high magnification on the blood vessels of the limbs, and then decrease the magnification, go central on the red reflex. You will have a good red reflex all through the surgeries. And believe me, if you do this, you will need to do a refocusing again, unless a limited time.
Yeah, thank you. That's also the opportunity for me probably to remind that it's relevant always to check, especially if there are many surgeons using the same microscope, to check that the parafocality has been done, so that the oculars have been set exactly to the appropriate eye, which is given for granted and is not always the case. So this is actually an important question, an important topic. Thank you for underlining that as a topic. Good. Maybe one of the last questions here. do you remember what are your settings? So that means what are the percentage of the two lights? So the autoflex on one side and the main light, what kind of balance do you normally use?
20% main light, 100% autoflex light.
Okay, so
this is the standard. This is the standard. 20% main light, 100% autoflex. Don't close the main light totally to have a good recording view, and don't concentrate the light to autoflex light. Go for maximum autoflex and give the main light to 20. And believe me, this is the main advantage when you are working with Leica microscopes, that you're controlling the post light separately. You don't need to close the main light to have a perfect red reflex. You can have a main light with a perfect red reflex.
Thank you very much for this last question and last answer, Dr. Tawfik. We still have a lot of unanswered questions probably, so we would invite the audience to connect either directly with you on the application side, or we will also be the vector of the questions potentially, or we can answer the technical ones about the microscope directly. So thank you very much for your time, your effort, your passion, and your time today, all the preparation. So thank you everyone online for being with us tonight. The Leica 2021 online cataract symposium has now come to an end. It will also be available online on demand. We recommend you to share the replay link with your peers. And thank you again for having been with us. Enjoy the rest of the day. Goodbye.
Goodbye.